All right. Thank you so much for joining us. My name is Tina Watkins from Inhand Equine Therapy, and we're really excited to bring forward these team talks. Being part of a team approach to your horse is really fundamental to Inhand, and I'm really excited here to be here tonight with one of my best friends, Dr. Chad Hewlett. We've worked together for the last 25 years. Chad Hewlett is a sports medicine vet here in Alberta, but has studied and practiced all over, and we're really excited to have him here tonight. He's probably one of the few guys that if you have a needle in your horse's haystack, Dr. Chad can find it. If there's something that you've been struggling with for a long time, Chad's always my guy to go to when there's something that we just can't figure out. It's really a blessing to me to have Chad on my team because he is really interested in the true team approach. He sees as much value in everybody's job as he sees in his own job, which I think is really vital to have a team member that wants to work with you like that. We are going to ask for any questions to be typed into the chat. The Inhand team that's on tonight, Carrie Passy and Cassidy Barnard are the Inhand team along with myself here tonight. We're going to group those questions together so that when we have Chad's valuable Q&A time at the end, we can make sure that the questions are grouped together and it flows just a little bit better. Thank you again, Dr. Hewlett, for being here tonight, and we're really looking forward to the presentation. So I'll let you take it away.
Hi, everyone. As Tina said, my name is Chad, and I've been fortunate enough to spend about 30 years in equine practice, mostly in the southern Alberta area, and practicing kind of on all disciplines of horses. So it's nice to be able to look at the different sports and be able to meet the different people that go through that. And through the years, Tina and I have spent a lot of time. So I just want to make sure I said thank you, Tina, for having me again. And it just feels good to be back doing some stuff together. We haven't done anything for a little while together, and we've done quite a bit over the last few years. Both of us are very into the approach of how we look at it from different ways with different people inside of our teams. I think that provides quite a bit of expertise and gets us a lot further down the road. So tonight, I'm going to go through some things that I put together. This is a lot of stuff that's of interest to me right now and what I've been reading from a personal standpoint. A lot of times the things that we end up using in the horses come from the human field. There's just a lot more money in the human field, and so there's a quicker way to get research done, and they dive into some of the things that we want to see in the horse field, and we tend to try to borrow a lot of stuff from that. So I'm going to talk quite a bit about some mitochondria tonight, and you'll see once we get into the slide deck and we start going through things. So if there's things that you might not understand about mitochondria or inside the cell, we'll definitely want to go over that at the end, okay? Also, I have a very conversational style, and I'm going to try to stay very flat or like high level in the sense of like, I'm not going to get into the weeds and try to talk about all the organelles inside of the cell. We're not going to go over a bunch of deep research that's going to get boggy. I just want to be able to take from a cellular level and kind of come to it so that we can look at the horse as a whole. So you'll see on that first slide, we can go ahead and bin. Okay, so I think most of the folks out there that are in the body working world and anything to do with sports medicine, we look at a lot of the conditioning that's going on and then competition and the effects on the horse's joints. I'm going to go into a little bit of talking on all parts of the body as far as like the muscles, the ligaments, the tendons, the bones, that sort of stuff. Obviously, my focus has been a lot on joints, so that tends to be kind of how I look at things. Is our job at our practice, and I feel like most veterinarians, to be honest with you, is figuring out how to find the source of pain and then be able to treat that or mitigate with it and use the available resources to us to try and either alleviate or eliminate that. That's kind of what I've come to over the last 30 years in practice, is that essentially it's just like find the right spot and then find the right treatment. Okay, so we'll do a quick outline. As I said before, we're going to go kind of from the micro to the macro. Okay, so we're going to start with the cells, go through a little bit of the stuff with the mitochondria. We're going to focus on that one particular organelle tonight. We're going to talk about conditioning. We're going to talk about competition. Then we're going to talk a little bit about how the biomechanics work through that. And we'll be moving through all of them kind of in accordance. And if I get to, I know we talked about leaving the questions to the end, but if there's something inside of that and you want to slip something to Tina on the chat, if I get into a rabbit hole or I go too fast, just don't want to do that, right? Like that's my goal every single day whenever I'm working with clients is like, do they have the same understanding that I'm coming from? Okay. So we'll jump into this next slide, Ben. Story. I went to vet school, graduated in 1994. It's 2024. So this is my 30th year coming up. And as Tina would say, and as I think most of us that are fortunate enough to be in the world of working on animals with sports medicine, especially the horse, because that's our focus, it takes a long time to put your systems together. And so we're going to go through a system tonight that I use pretty much with every single case that I look at. And it's how I teach my interns, also how I communicate with other veterinarians based on, that system, and it's repeatable. So it allows us to get into that. About 2,000 to 2,500 head of horses a day over the last 20 years. So it just gets repeatable, and we're able to put it together and then bring things through. This is this mitochondrial part. We can go ahead and go to the next slide. This is something that I studied in 1980s and the 1990s before I got into vet school when I was an undergraduate. We talked quite a bit about in the cell, and we went over a bunch of things. And at that time, it was kind of like, okay, well, you have a cell membrane, you have a nucleus, you have a mitochondria. The mitochondria is the powerhouse of the cell. And that's kind of where that was left, right? Like I can remember being in basic biology and in anatomy, and we just went through the cell. We talked about it. We talked about the mitochondria as a powerhouse, and then it was just kind of left with that. We discussed quite a bit about the mitochondria. I'm going to go through, we talked about the different feeds. If you look on there where it says mitochondrial DNA and the cell, and it shows that little powerhouse, that little wavy specimen that we see on the screen, that's a mitochondria cut in half. Obviously, you can't see them with the naked eye. That's an electron microscope sort of view, because they are at the subcellular level. If we go, then we'll talk a little bit about cells, and just going from the inside the cell to the cell. Then we talk about tissue, then we'll talk about the systems, and inside of that we'll talk about muscle/soft tissue. We'll talk about joint tissues, bone, and then the nervous system. Okay, muscle. So in that screen, if you can go kind of to the top left-hand part of the picture, and just below you can see that's an arm, and that's a bicep muscle that's being dissected there, and then it's showing us the different cells that are within inside of that. And inside of that cell is the mitochondria. There's oftentimes in muscle cells, there's hundreds, if not thousands, of mitochondria there to power this cell. And the reason I want to kind of go over this is a little bit is like most of the training that you're doing and the conditioning, as we would guess, is setting it up so that we can condition this muscle so that when we do go into training, that it's ready for that performance. And I think one of the misconceptions sometimes that Tina and I deal with daily, and I think a lot of people in the support world is that we'll often hear people talking about, I'm going to go train my horse, or I'm going to do this. And we're looking at it from the standpoint of, well, we haven't even spent 45 days in training. And so I want to see the turnover of these cells and these cells adjusting to the stress, because it does put us in a better spot when we do go to competing if the conditioning's been done appropriately. Okay. So then we have the muscle system. So we get to that, that's going to be the whole body. So if you're just taking it from the micro level and now we're going to the macro level, we just want to be able to look at it from a system. So the muscle system would be the entire body. I think there's quite a few sports therapists on this conversation, and I know that's where you guys spend a lot of your time, is working on muscle tissue, mostly associated with the fascia, and trying to be able to have those muscles be in a spot where they're healthy enough to do the job and recover from what's being done. Then we'll go to the next slide if that's okay. This next slide is on joints. So it's the cartilage, the capsule, and the subchondral bone. So if you look on there, we'll start at the very top on the healthy joint, and we'll work our way down. So we've got a joint capsule, as you can see on the slide. Then we've got synovial fluid inside the capsule. Then we've got the synovial membrane, which is the covering around the outside of it. And then we've got the subchondral bone. The reason that I want to point these out and go over these with you now is that when we get into the nervous system, we'll be looking at the different ways that nerve pain causes the body, guides the horse in what's going to protect them. If we look kind of to the right, I thought this slide was perfect for what we're doing, because it shows a healthy joint on the left with the right amount of joint fluid, and then on the right you can see that there's extra joint fluid. Usually what ends up happening is in these horses, if there's an upset environment or an environment where there's a lot of stress on a joint, so they come from either normal stresses or abnormal stresses on a joint, we'll see that fluid become extra because the joint's trying to protect itself, right? So this is kind of a nice way for us to go through that. We'll go next slide. Then we're talking about the bone. And I know this is really basic and you guys know all these things, but I just want to make sure we have a really good base on this today. So axial skeleton, appendicular skeleton. We all know the axial skeleton is essentially the head, the neck, the thoracic vertebrae, the lumbar vertebrae, all the way back to the tail, right? It's basically that skeleton that runs down the middle of the horse. And then the appendicular is going to be like the hands and the foot on a human, or the front leg and the hind leg on a horse. Inside of that, we know that those two, I want to make sure we talk about the fact that those two bone systems, okay, are adjusting. If we have pain in the left front foot, whether that be soft tissue or bone, you're going to see that horse's neck adjust to that. You're going to see that head adjust to that. For sure, you're going to see that sacroiliac adjust to that. So we want to go through the fact that when you have a spot that's being affected in the training, okay, or in the conditioning, that the repetitive nature puts a lot of stresses into those areas and can change how the mitochondria is being developed. So I'm going to try and drive at that cell again here and talk about this from a standpoint of like how we feed, how we rest, how we condition, and then how we get a horse to come back, and then being able to put our finger on, is this horse actually ready for competition, and how much competition can it handle, right? I think that's going to be the underlying theme that I'll keep coming back to tonight. So we'll go from bone and we'll go, let's go next slide, please. Okay, so we'll go to the nervous system. We're going to spend a significant amount of time on the nervous system tonight too. As my practice has matured for the last 10 years, I think I've moved away from, or I've moved heavily into like nervous system function. And if you spend any time around me, or if you watch some of my talks in the last couple of years, I've talked a lot about nerve pain and different things that are related to it. And I think it's because I see it as such a driver, right? And I see a lot of the accidents that we see, or biomechanical things that are, biomechanical forces that horses are using and how they change. It comes from that nervous system response. And when we look at our own body, like Tina always, when I first started hanging out with her a lot about 25 years ago, she used to say to me, you really could use a good body worker because you're all kind of twisted around because my left shoulder was all off and my right shoulder was turned forward. And that's just the nervous system causing us to react to the pain that's in our body, right? And then we end up having a muscular skeletal system that torques to that. Central nervous system, okay, and when I was in school, I'm just going to go through a quick 1990s sort of approach to how the nervous system was taught. And then I want to bring you guys up to speed of what's happened in medicine over the last 15 years. So it's pretty revolutionary. We believe that the central nervous system was king or queen, however you want to look at that. And then all the lower nervous system, which would have been the peripheral nervous system, was at this sort of at the beck and call of whatever the brain would to do. But we found out in, I think, the early let's say 2004, 2005, that there's as many nerves in the belly or in the gut system as there is in the central nervous system. And from an evolutionary standpoint, many scientists are now believing that maybe the gut actually trumps the central nervous system often, right? And so do the legs, the appendicular skeleton has quite an effect on what happens with the central nervous system as well, based on evolution and being able to adjust to life's forces. So inside of our training or our conditioning, it would seem that it would be a wise place to start in the sense of making sure that we are comfortable in our gut, i.e. belly pain, how we eat, how our body responds to that, and what's working, because those nervous systems, along with the cells and those little mitochondria, little mitochondria inside of that, are all speaking back and forth. And we look at the DNA that ends up manifesting in the cells, okay? And I'm not going to try and get too far into the weeds, but we believe that nervous system is affecting the DNA and the mitochondria inside of the muscle based on either pain responses or adaptive responses, okay? So I'm going to tie that back. Peripheral nervous system, you have skeletal and abdominal, which we just talked about. And then I talked about how the central and the peripheral communicate. I want to really drive home that they're both of equal value as far as like what the body wants to respond to and how it's listening. Not one's telling, both are telling. It's kind of like how do I say this? It's like a good marriage, right? You're a good partner because you give good feedback, and you're also a good partner because you listen, right? So I think those are the two things that we'll put on that. Okay, go next slide. Okay, so we're going to talk a little bit about the types of pain. Again, I'm not going to try and turn you into a pharmacologist tonight by any means. There's nociceptive pain, inflammatory pain, and neuropathic pain. And I've talked about this before. I'm going to probably keep talking about it, not to an ad nauseum over the next little bit, but it's just understanding this helps us with our training and with our conditioning, okay? So let's go next slide, Ben, and we'll talk about nociceptive. Okay, so nociceptive pain is caused by activation of the pain receptors in the body, secondary to an abnormal or repeated abnormal movements, okay? And so, again, this comes into our conditioning. If a horse has a particular problem that it's dealing with, even if it's a low level, and these are your horses that it's like, I get on that horse and he or she is a little bit creaky for the first 10 to 15 minutes, and then all of a sudden things get a lot better. And I don't know how many people are in the room, but you've probably heard me say this before. When I do CrossFit in the morning or I lift with our group, the 25-year-olds in the room, they look pretty good at the start. The old 56-year-old gray hair, he looks a little bit crippled at the start, but within 10 to 15 minutes, I feel very fluid. And I think that has to do, or not think, I know in myself that has to do with, I've got a shoulder and I've got one knee that, they just have had a lot of injuries. And so I think we want to be respectful of that with these horses too, because that nervous system is speaking to that horse whenever you're doing those warm-ups and how we set them up, and then timing our conditioning around the fact that once that horse is warm, then we can start to do more things that we would want to do. And finding that zone and knowing that zone in our training is important. If we bring it back to the cellular level, okay, if I'm trying to do too much, or the rider's trying to do too much inside of that window before biomechanics are at a good place, how am I affecting at the cellular level inside the muscle, the tendon, the bone, the cartilage, and all those other parts of the body? So if we want optimal mitochondrial health, so we have optimal cell health, we want to understand that when that nervous system is turned on, that's not going to be optimum for us, especially in a flight animal, okay? We'll go next slide. Inflammatory pain. This is the one that we're all used to. It's resulting from the release of inflammatory mediators that have a strong effect on surrounding tissues. They may trigger the nociceptive pain, which is the one we talked about before, which is almost like a sensory pain versus an inflammatory, and it increases or stimulating sensitivity, increasing pain levels. This is where you're looking at your NSAIDs, non-steroidal anti-inflammatories or steroids. We give that to reduce that inflammatory pain, so that those horses, they also feel a reduced amount of swelling, but mostly it's inflammatory pain that we're used to thinking about in the horse world. It's like, it's warm, there's extra fluid in that area, and when you touch it, there's pain that's elicited, or that horse is moving away from that particular area because it is inflamed, okay? And that's the most common pain that people think of. Okay, go next slide. Okay, and this is neuropathic pain. This is probably the most difficult one, even for myself, being medically educated and having done this for 30 years. I still struggle with this one, and it's been the human side of things and the dog, but especially the human side. I mean, there's a very common association that once a nerve has been fired, let's say your left index finger has chronic pain in it. The pain that you feel up your arm from that finger being turned on all the time, that's actually neuropathic pain. It has very little to do with your finger, and it has a ton to do, here's my finger. It has very little to do with your finger, and it has all to do with this nerve that's running up your arm. And when you talk to humans, we know that that's a problem that people deal with all the time, and it becomes chronic. Oftentimes that's when you'll see people that maybe aren't in the best mood, and different things that happen. I've got several clients that once they have a knee replacement or a hip replacement, you're like, they just seem like a different person. And when you talk to them, they report the same thing. You see them in a better posture, better position. They seem like their face changes, their eyes change. I can't think that a horse wouldn't have similar things. So I think we want to work off of that, in the sense that if a horse has got a chronic left hind lameness, then we need to be aware of the fact that it's not just that, let's say it's the hock joint or the suspensory, or we'll just call whatever we want that's on the appendicular skeleton. As we run those nerves up to the axial skeleton, which would be the central nervous system, there's a lot of research going on in the human field right now that says that nerve, as it gets closer and closer to the spinal cord, could be a big contributor to performance and the way the body works, as well as the pain. Okay, so I'm going to drive back, as we were talking about, going back to the micro. So if we start going back to the mitochondria, and how everything that we're trying to do is to develop a beautiful mitochondrial system that will drive our, allow our animal to eat and to be healthy and be able to recover. Okay, next slide. Conditioning versus competition. We put this slide up because we're going to have all these different disciplines, but this is a very, very high level dressage horse, and you can see all the things that it's doing. This is at a competition. Okay, the rider is up, the horse is doing its job exactly the way it should be. Okay, and when we get into these competition situations, we're thinking oftentimes about, oh well, I'm riding the horse and its muscle system's doing this and it's doing that. But if we come back to and we try to tie all these things together, let's think about, well, what if my gut's coming because I've used my diaphragm appropriately, which we talk about a lot, right? Inside of body work and inside of veterinary medicine, and my abdominals are tightened up. But now I've got some nerves inside of my belly that aren't quite happy. Now they're talking to my central nervous system, which is trying to activate the musculoskeletal system to drive the joints. And you can see where I'm kind of going. I'm not trying to confuse things, but it becomes compounded. And a lot of times when we're looking at these particular athletes and we're trying to figure them out, it becomes difficult to figure out, like, is it just a competitive thing? But what's driving it from the conditioning? Okay, so we'll go next slide. I tried to pick a slide that was pretty blah, right? Because I think most of us would say that conditioning would be a good time to connect with the horse, but I feel a lot of people are in horse sports because of the competition, right? Like, I mean, we all have that competitive nature, a lot of us, but the reality is like, if I look at my veterinary career, there's very little time spent in front of the camera like I am tonight. Like, I spent 20, 25 or 30 years preparing for this moment, so to speak, right? By all the research that we do behind the scenes. And I think conditioning needs to be approached in the same way. It's like, you do the miles, you log in the hours, the minutes, however that looks, how you pick your feed, how you pick the stall that your horse sleeps in or the area that it rests in as far as recovery. We're building those mitochondria again. And I know I'm boring you guys to death with the mitochondria, but that's the whole reason for this talk, is to come to that. So if we come back to the thoughts of conditioning, and conditioning prepares us for competition. We don't play our sport to get fit. we get fit to play our sport. And I think that's one of the things that I want to look at. And oftentimes we just think of cardiovascular, like blood, and we think of lungs and muscles. But we need to realize that at the core, it's each little cell that we're conditioning. And the better we can condition these mitochondria and the more healthy they are, I think the better our athletes can do based on performance, but also based on recovery. Next slide. This is a high-level cutting horse with actually Canada's most winning horse trainer in the cutting. It's Dustin Gauntlet, on a really nice horse. And I wanted to kind of come back to the fact that if you look at what this horse is doing, I mean, the dressage horse was impressive, right? Like, we're up in the air, going across the pin. Now we've got a horse that's sitting down in 1.5 feet of sand. Its stifles are almost touching his hind, the rider's feet, and you can see the sand coming up underneath the chest. So these horses are doing some extreme things at competition. But inside of the conditioning, I don't think we need to be calling on them like this all the time. It's like, how do we get them to train appropriately in a lower level? I think that's the big thing with these mitochondria, is that we don't need to go out and beat them up every day. It's more of a, what are we doing on a steady basis? Tina and I often talk about, it's like 1 or 2 days of simple, straightforward training, and then you're going to have some pretty good testing, and then you're going to have maybe a day off, and then you're going to go with 1 or 2 more days of solid training, and then one or two hard days in a week, and 1 or 2 rest days. And I'm not trying to get into the training thing, because that's not my realm, but I think just understanding how a horse recovers, and that you are working at, with your feeding and your training program and your rest program, working at building these cells in order to drive these tissues, which drive these systems, which propel your horse. Okay. Let's go to the next slide. Okay. This, if you watch one of my talks before, I have used this stick horse approach, and I'm going to try to go through it reasonably quick, so I won't bore you, but I just want to make sure that we're all looking at it and we can kind of get a bit of an idea. It's a quadruped, and so we have a front and a hind, and we have a 2.5 foot long neck on these horses too. So you've got quite a bit of biomechanics at play that the human athletes, it just doesn't get this complex, right? So let's just break it down with some simplicity. Sorry. Okay. An introduction: a leg is a leg. Okay. Rotation counterclockwise, and this is a force that can end up coming on through the body, through the head or the neck. It can also be coming through the lower limb. Then there's clockwise rotational force as well. Then we have dynamic rotational forces, as you can see when it's coming across the body, from the front to the back, or from left front to right hind. Okay. And then you have the dynamic force of up and down. Okay. So let's just take a little look on the screen here with a normal horse with normal propulsion. Okay. When they go along, and you guys would agree with this when you ride, you're going in a straight line, but the body's got kind of a bit of a serpentine move to it as we go along from the head to the neck. And you see I've drawn that on the left side of the screen, kind of the motion of the body, but the horse is going in a straight line, and everything is balanced in this picture. Okay, so we'll go to the next one so we can get an idea. Again, we're dealing with a quadruped. Okay, so let's just say it's a left hind joint and a right front soft tissue is being affected. And you can see now we went away from that nice little perfect 2 straight lines to where that cadence has become a bit of a bow instead of those nice perpendicular, because those horses will tend to push out that way as they're moving away from that. I know it seems very simplistic, but it is simplistic, and that's the nice thing about it, is it's just like, boom, here we have this problem. We're now bowing out to the right on that horse through the back and through the head and through the neck, and we're seeing the extra pressure on that soft tissue on the right front. If we continually do that throughout our training program, we're now changing at the cellular level the mitochondria in that right front soft tissue region, whatever it is. Could be a suspensory, could be a deep digital flexor, it could be a superficial digital flexor, it could be something to do with the shoulder or a triceps muscle. But just keeping in mind that we are changing, or those mitochondria don't have the chance to respond, and that's where we get into trouble with our injuries. Okay, go to the slide. This is right front joint, left time soft tissue. So we have a very similar type of movement, again, in the sense of just that diagonal that's set up, and keeping in mind that the muscle system and the bone system and the joints all are trying to respond to this, and the mitochondrial health in those areas is going to be different depending on how that horse is responding to the pain. And this is just very remedial, but left front joint, right hind soft tissue. We can see again that we've reversed the way that that horse moves, and now we've got the body is bending to the left at this point. Go to the next slide. Same thing with a soft tissue and a joint behind. We've got that same motion, and that axial skeleton and the appendicular skeleton are both adjusting to that throughout their tissues. Okay, so I'm going to try to get just to get a closing together, and then Tina and I'll do some talking and some questions. And I feel like with the Zoom tonight, I'm sorry, I kind of jumped through that last bit just a little bit so that we don't lose our spot if something happens. I spent quite a bit of time talking about mitochondria tonight, and talking about the cellular level and how it relates to the macro level. I want to use the question answer period to get into the things that you have and try to get it to be a little bit more interactive, and so that we can tease out some things. If some things don't come to light during the questions that you guys ask, I'll move into some other ones. I just want to be able to be a little bit more dynamic so that we can get into, because not every day do you talk about mitochondria and subcell stuff, like in that realm. I literally only read about it. I don't talk about it in most of my daily practice, even though I'm using it. I talked about conditioning. I talked about the competition that comes afterward, that we use, why we're all doing our conditioning. And then I talked a little bit about the biomechanics at the end. Okay, perfect. Also, I just want to say, we'll get this at the end, but I really appreciate Tina asking me to be in participation today. And it's just been a great relationship over the last 25 years, doing things together. For sure, one question came up. It's perfect. So I saw a question come up. Do you have a team there on a bilateral front leg lameness? Mm-hmm. Okay. So, Ben, can you switch to me? Is that okay? Because we'll get into where it's going to be a little bit more interactive, and we can go through some scenarios and talk about some different things. Okay, so from a front leg lameness, can we switch to the board? Is that okay? All right. Okay, so we're interactive now. You can see me okay?
Yeah.
Everything looks good. Okay, so let's just go back to our stick horse here real quick. And question was bilateral front leg lameness. Okay, so here's looking at it from the top. Let's come to the side now, and let's think about this leg and this leg reaching. And I know you guys think about this, but so in our picture with the dressage horse before, one of the things that we end up seeing with these horses that are bilaterally front leg lame is this phase will be shortened. And so when this horse sticks this leg in the ground here, in order to lift the next leg out, we see that anterior phase will end up being shortened, and those horses will do where you end up with I move my pins to come on for start. Here we go. So you're in and up with a system where they're both back and forth, right? So I'm going from left to right, and not just bowing in one direction. I'm bowing in two directions based on, sorry, I'm just trying to get where's my best spot? Is this okay? Right there, yeah. Is this better? Okay, can you guys see me okay?
Yeah.
Okay, perfect, sorry. Just want to make sure I'm in the right place. So from a standpoint of what happens with the bilateral front leg lameness, you're seeing that body go back and forth more than it should. It doesn't get that natural motion. Big part is if
if I'm not comfortable in both of my front feet, then it becomes very difficult for that horse to like move out. And I think the most obvious one is those big dressage horses, when they need that big elevation in order to go about their movement, right? Does that help?
Yeah, I think that helps for sure, Chad. But as well with that bilateral, can you explain to us then what happens with the back and the hind leg? I think you did a great job of explaining the front legs that they shorten, but what happens behind?
Okay, so we're going to see as well, a lot of times you can deal with two things in horses when you're doing this, and it depends on how the rider directs this. This will come underneath. Some of these horses will end up being underneath themselves. They will adjust through here, and we'll see some of that end up being in the sacroiliac. You see the odd horse too, and I don't have the best explanation for this, and Tina's probably, well, we've probably all seen it, is you'll actually see the opposite of what you would think, where they'll hollow out, okay? This is the more common one for me to see, is where now my horse is trying to throw its hind legs underneath in order to suspend this axial skeleton, is what I see usually. You'll see the odd one that gets a little bit too high, but most of the time you'll see them kind of trying to get their pelvis curled and get underneath. You can see stifles load up. You can see soft tissue injuries that'll happen in the back end. I would say the sacroiliac is probably taking the most of it in the hind. That's what we find.
Okay, that's great, Chad. So I had a ton of questions come in, so I'm just going to start a bit from the top. Okay. First one was, if a horse is sore, then the muscle in all areas of the body can't develop fully. This was back from when you were talking about the development within the cell itself.
Yeah, this is, so am I still in a good spot to talk now? Okay, because I'm going to not move back. That's okay, I'm going to stay right here. So then, this is a great question, and I was hoping this one would come. So hopefully most people in here watch the movie Avatar, right? And if you haven't, just think a little bit about inside the movie Avatar. All they talked about, like not all they talked about, but a lot of what they talked about in that movie was how the plants were talking to the tree roots and all that, like how everything is connected. And I think that's where I was trying to drive with it. I know that's where I was trying to drive with this talk tonight, is that the healthier our system is, the better it can recover. So I believe that for sure, if I have a problem in my forearm and the rest of my body's dealing with it, I will end up disrupting the cells in this because they're hurt, but I also end up disrupting other parts of my body or the other parts of the horse's body in order for that to adjust. We know that the bicep muscle talks to the hamstring muscle, and there's a concordance going on through the nervous system, right? That's something that we didn't understand real well, and they're definitely starting to get a hold on it in the human side, as well as that muscle is developing. Just think about what's happening with the bacteria in the gut. It becomes a little bit complex because the ambulatory, or the system that's moving the horse around, that's mobilizing it, if the gut's talking to it, then the gut is there to actually help that system find food and the food that it needs, right? Hopefully I'm trying to do a good job of explaining that this becomes complex. I don't want to make it complex, but just thinking about the fact that how we control that nerve pain and how we're able to allow that body to move is a big part of the whole system, even though it's just in one leg.
And if there is a pain cycle that is spurred on by that area that is sore or hurt, then how does the body start to slow that pain cascade? How does that allow the body, or where does the body then go to from that point?
Okay, well, there's the natural development of our own natural pharmacy. I guess the thing that we look at is, a lot of times from our standpoint, is this is where I have a strong opinion on using inflammatory pain medications for horses to quiet that down if we're in that sense, in that area, because a lot of those horses are overloaded on what their natural body can do. You're going to need time and rest on some of those horses in order to get that to catch up. I guess the question is like, how do we add in the veterinary medicine so that we don't lose a lot of time, right? And I guess that's the big management, is like, am I putting enough stress on the body during conditioning so that I can strengthen those muscles to protect those areas that might be injured, i.e. if you've got an arthritis in a hip or a stifle, a sacroiliac, you can't make that go away forever. But if you can do the right things inside of the conditioning, you can develop the muscles around that. The nervous system will be able to acclimate to it, and the gut system will get on board. And then when we go to the competition field, once that horse is warm, then it's got its natural system set up, but we've used the body to protect it.
Yeah, very good.
Am I going the right? I'm kind of going the right direction there. Yeah.
And you've gone almost perfect into the next person's question. This was back when you were talking about warm up and cool down. And the question was, if a horse is not functioning in one area, can that tissue warm up and become elastic?
Great question. Yeah. So my answer to that is yes, they can. I think we need to focus on a lot of joint mobility. So the joint, let's say it's a biceps muscle, let's just use that as an example, or a hamstring in the stifle. I think the big thing is that we need to make sure that for that hamstring to fire properly, that the hock and the stifle are both warmed up, and that comes from blood flow. It also comes from low level riding. So sometimes we believe that we need to jam things up, and one of the things that you read quite a bit in human medicine right now is the zone 2 thing. And so zone 2 is a very boring sort of exercise, and they're recommending that humans do somewhere between 2 and 4 hours a week, but basically almost a little bit faster than walking. I can't help believe that the horses don't have something similar to that. And that's the kind of riding that we would consider to be, hacking, and the kind of stuff you're like, I don't know if I even did anything with my horse today. I think those kinds of activities are being missed a little bit in that base. If you're in more of a speed sport, I mean, even with dressage, you've got those events where you need that like punch, right? But I don't know that the punch is that we need to train the punch. I think we train the endurance underneath, and then those mitochondria are turning over. And I think that's a big part of that inside of this area. When you ask this question about like, how do you warm up a particular area? Well, the question becomes, if you go at a speed that's slow enough for that area to adjust, then the nervous system will let the circulatory system feed it, and then you'll see the warmth come and the muscle will start to catch, right? And I think the key is as a rider, and again, I know I'm not offering a lot of solutions tonight, but this is so new to me. Like this is something that's like new to us in the sense of like understanding that. So it's like, if you thought you weren't doing enough, you probably are doing something, right? The walkout, the cool down, all that sort of stuff. We consider that super important to bring out the toxins after we're done. But I think the slow warm up is something we're going to see more and more, in the sense of like, maybe these horses need to be walked literally for 20 minutes, no trotting, right? When we first get on them. I don't know that that's the truth, but I'm feeling more and more that there may be slower warm-ups than we actually do. We may be into too fast a warm-up because we feel like I got to do something, right? I know that's the thing that they see in the humans.
Okay, awesome. And it's funny because the questions are just going with exactly what you're talking about. But the next question earlier in the talk was, does the nervous system drive fatigue?
Okay. So then I'm going to jump from some different examples. So let's just look at barrel horses for a second. We know some of these barrel horses are actually bleeding before they go and run. Well, they haven't done anything physical, so it's their nervous system that's blown up their circulatory system. So the answer is, yeah, you know, if we can keep that nervous system at a level where it's not firing too much, like when you're doing weight training for a human, and it's no different for a horse, there's the simple mechanical force that's happening on your body. So there's that stress, But the big thing that they talk about a lot of times in body, like in weight movement, let's just say weight training, not necessarily bodybuilding, but weight training, is the muscles may not need as much relaxing as, or much downtime as the nervous system does. So I think understanding that you're on a flight animal that has a nervous system that's already, like if here's a human and we're kind of idling like this, I would say that a horse is elevating, is idling at another 1,000 RPMs higher than we are. That's an example. That's not an exact number, but I just feel like a flight animal tends to have a little bit more of an alertness nervous system, and the more subtle the movements are, or strong the movements are, the horses respond to them, I think, a lot quicker. So we're trying to manage their nervous system. I still know that inside of that, we're trying to teach horses to do things, and we have timelines, and we have futurities, and we have, international level competitions. So the question is like, how do we challenge that nervous system to achieve the desired results without blowing it up? And I believe this question is going at that. I think that's up to the rider in the sense of understanding that even little tiny things that you're doing, if you're doing them consistently 4 to 6 times a week, I think you'll see more response to that versus I've got a competition in 3 weeks, I've got to ride the shit out of my horse sort of thing, versus I know I'm going to compete in the summer, so maybe I should start riding in January. I think that's where I'm it's very simple and it's very soft, but I keep coming back to that. It's like, the more I know about this, the more I'm starting to believe that it's about that multiple times a week and getting, somewhere between, let's say, 45 minutes and an hour and a half in. And a lot of that's going to be pretty boring riding,
Right.
I think, is where we might end up. There'll be some competition stuff that happens during the training, but a lot of it's going to be just simply getting the body moving and then being able to do minor things that we look through that training session.
Okay, that's great. The same person asked, how do I need to warm up an area that I know has a problem or dysfunction in my horse?
So my suggestion is, let's say it's we talked about a bilateral front leg lameness. Okay, that's a very common thing. In the quarter horses, we have the heels are a problem. Like we have the bilateral navicular syndrome or caudal heel syndrome. In the jumping horses, we x-ray a lot of horses and dressage horses that have pastern arthritis or pastern inflammation. So it's the same thing. They're about an inch apart or 2 inches apart. So in the body, it's very similar in how they would respond to that. I believe that you can tell from the fluidity of how that horse is moving before you want to start into it. So we know that it takes somewhere around that 10 minutes for blood to flow to the joints and get them warm. Again, this is stuff that would have to be tested to see, but it's like, is that a walk trot phase? The answer is yes. I believe the walk trot brings that blood flow, and we're going to be 10 to 15 minutes into that area before we're going to be able to see things become more fluid. Right?
Okay.
In general, that's been my rule of thumb. You won't see it much before 10. And if it's not coming by 20, then we've got the wrong thing going on. We probably should be looking at, like, does that horse need some attention, right? If it's not warming up by 20.
Okay, perfect. And this is just flowing in perfect because 2 questions down from that was, if my horse continues to be rein lame or asymmetrical, does that mean that there's something that I need to have looked at? I think kind of going back to how much time frame before we decide we need another team member. Yeah,
good. We're getting into the practicality, and I'm really glad that this is teased out in the questions, because I didn't really want to try and add it into the talks. This is perfect. So for me, if a horse is warming up in less than 10 minutes, it's probably just soft tissue. If it takes 10 to 15 minutes, we're probably getting into either ligament or bone. And these are generalizations, but when we're past the 20 and the rein lame thing, it's okay. Well, at that point, is that neck have enough arthritis in it, or does the shoulder have enough, restricted movement that continued training of that horse is going to jam that nervous system up? and it's going to go at our gut. It's going to go at those, all that cellular development that we're looking for. We're going to start pushing that backwards. And those are the horses that are fatigued. And when they do get to competition, they're the ones that become difficult to handle. We need earplugs. They need, like all kinds of things. The barrel horses that have to have another horse to lead them in, the bleeders, those kinds of things that we see in that industry. I think on the dressage side, it's the horse that gets hot. It's like, oh, my horse is getting so hot in the pen, and their nervous system's so cranked up that that's their only way to evade is to become hot, right?
Okay, that's perfect. Next question is, how can I differentiate between muscle weakness or a pain/dysfunction response?
Okay, well, we got all the good questions. So this would be one of the most difficult things for me to look at, in a sense of like talking about just on the internet, but from a feeling of a horse, I would want to look at muscle development. I would ask quite a few questions about training and conditioning. How far since we've been back into our training? What's our competition level at? Is the horse climbing to another level? Is it coming back down? Those would be all questions that I'd have, because you're getting into the zone where this is a difficult thing to figure out. Is it just a weakness, or is it a pain response, right? And I think those can be tricky. Most of the weaknesses are gonna get better over a 2-week period. The pain thing is actually going to get worse, and it's going to be more difficult to deal with. That's a generalization. Okay, that doesn't make me right on that, but that's my general consensus when I'm talking to clients. I feel like if you have that question, it's a really good time to have your sports therapist come and go over some of the things, because you have your myofascial component in there as well. And so in the weakness, I tend to look at the myofascial component as well.
Okay, I love that. Next question was, how does a rider know what type of pain my horse has? You have mentioned a couple types of pain. And is it important for us as owners to know the difference in the types of pain?
Yeah, good, tough audience. This is great. This is awesome. So I would say that in general, it's very difficult to look at the different pains and know by just looking at a horse. I think you have to do some investigation in the sense of putting together, okay, if I feel, let's go to a coffin joint that's bothering a horse. If we went to that coffin joint, the very first thing I would do is like, do I feel pain? Do I feel heat? And do I feel sensitivity? Okay, well then I know I'm in that inflammatory phase, right? There's going to be some nociceptive in there too, because I've distended the tissue, okay? Then I can put a strong feeling on the fact that the nerves, so the palmar digital nerves that are coming out of the back of that, I think this is part of the reason that when we do nerve blocks, we always talk about we're looking for 70 to 80% improvement on a nerve block. I think part of it is that we're not able to take that nerve pain away, right? And so there's going to be some nerve pain going up that nerve. I would say with that coffin joint, it's going to be, my experience would say that that coffin joint would be 90% inflammatory based on the heat, the swelling, and the sensitivity. I know there's some nociceptive in there. My inflammatory, medications like butanamine, dexamethasone, and cortisone, hyaluronic acid, all the orthobiologics are going to work at that level, right? They are only going to take care of the pain that comes up the back of the heel through the palmar digital nerves. That's only going to be taken care of through the relaxation of the inflammatory at the bottom. Like, it's going to be a secondary nerve pain that's going to go away. I think in the human side, they're going to get this kind of figured out because they can ask questions and they can talk to people about that and sort of knock it down into days. I believe in my mind that nerve pain away from where the injury is, okay, so the nerve that's feeding that area or taking the pain away, taking the pain reception back to the central nervous system, I think around 60 days. This is Chad Hewlett. This isn't evidence-based medicine. This is just clinical practice. I think around that 60 days, we can start to see that there's some chronic nerve pain inside that nerve. That's just a gut feeling. of trying different things and doing things in the last 3 years. Right. So this is really touching on some stuff that I want to talk about. So
no kidding, this
perfect.
is fantastic.
Yeah, I love questions.
So the next one was about recovery. Is each horse need a different amount of recovery? Is it just age-based, or is it based on fitness?
Okay, this is good too. So I was just at the American Association of Equine Practitioners in Southern California about a week and a half ago, and they started talking about the new wearable technologies with heart rate variability. I think it's a missing link in the horses is this heart rate variability. I don't know about people on the Zoom, but I take my heart rate variability every single morning right before I get out of bed to see where I'm at and how I've recovered. I mean, it should be, in theory, for the human, when you wake up at whatever time you wake up in the morning, that's as recovered as you're going to be before you start your day. And I think that's where we're trying to look at these horses is as a rider. Okay, so if we're not doing heart rate variability, you probably know in your mind, I know in my mind, like I got pretty sick about 14 days ago, and in the highest stages of my fever, my heart rate variability went through the floor. Like it was some of the worst numbers I've ever had. Right now, I can compare those together, and I think for riders, I think one of the big things that I see a lot of people do is, do you have a journal on what's happening and how your horse feels for the day, and being able to understand where you're at. I wouldn't say that I'm the best person in the world to give a heart rate, like the heart rate talk. I know on the endurance side and the 3-day eventing side, and I think some of the dressage, but for sure in those two disciplines, the endurance and the 3-day eventing, they do a lot of heart rate training, and where they're looking at like, does that, where's that horse's heart rate settle? Those are things that you would be able to evaluate subjectively along with taking their heart rate. But I think, did my horse clean up last night? What's the water bucket look like? Like what's the hair coat look like? When I go to catch it, does it want to find me? Is it running away from me? Is it, like those little tiny behavioral things I think would be a big part of it for me on the recovery side. Knowing foot growth. I mean, these are weird little things, but when you think about it, if the mitochondria is doing well in the body, in theory, the foot should grow pretty good. And so your trimming should fit with that. I mean, we see accelerated foot growth in the summertime. I think that's because the light hits the horse. They're light beings, so we are humans too, right? So it's like it hits and goes through that, and everything is allows us to, light sensitive beings to do that. So I think those are things we would look at. I would say that one of the strongest things that I would get from this, or I'd try to bring to my talk, and I would like you guys to take home, is just journaling on a daily basis and understanding where you're at with your training, how much you've called on, and like how steep is your gradient, right? Like there's life, first of all, right? Like we all have things outside of riding. Certain riders are fortunate enough that they exist inside the industry and they train horses and they're able to spend quite a bit of time with it. I would think most of us are weekend warriors. I don't like the word weekend warriors, but we have some other career and our horse is a big part of our life. So we try to spend, somewhere between 4 and 6 hours minimum a week with them. The question becomes is, can you journal that and understand your horse? I think those are where we're left with. The 2 research studies that were done recently on these wearables, one was Ontario Veterinary College, so they're both Canadian schools, and the other was I think it was in Quebec. I'm going to mess up. Saint High is the university there, because I can't say the full name. They published 2 really nice papers on just using them and getting them on the horse and seeing if they actually work. Right, that's the level that we're at right now. I think over the next 2 or 3 years, that heart rate variability is going to become a big part of it. Okay,
and that goes great into. I'm going to go back to a couple questions. If people think I'm skipping them, don't worry, I'll get back to them. But the question down the way here was, the only thing that I know as a rider to evaluate fitness is a heart rate monitor. So you've pretty much answered that. But also then the journaling and making sure you know your horse better.
Yeah, I think I would agree with that comment that the heart rate monitor is the holy grail. I mean, in human medicine is too, right? Like when you're trying to do zone 2 training, they want you to wear a heart rate monitor. They look at lactate levels, and I know for sure that's something that we could do in the horses too, is kind of try to figure that out. But that takes a lot of research money and takes a lot of time, and you got to poke the horse. Same with the human, you got to poke yourself and get the lactate readings. Those are all things that they're trying to figure out, is like, are you training with lactate or are you training without lactate? And the heart rate monitor has given us the ability to try and figure that out as best as we can, right? The variability part, and I don't know how many people know about heart rate variability versus heart rate. Do you want me to just do a quick go over that? Because heart rate is like how many beats per minute. Variability is the space between the beats, okay? And it seems like you would want a real consistent, like if it's the same, it would be great. But actually in nature and in research and the way they've looked at it, that higher the variability, the healthier or the more recovered you are, right? No matter whether you're a horse or a human or a dog or a cat or whatever. So that's a very simplistic explanation of it. We didn't, only in the last maybe 5 to 10 years have they really been talking about it. It's been something that's been known for a while, but I'd say on the human side, the research has really jumped up. There's a company called Loop, you probably heard of them, and then there's these rings where people are wearing these rings, and they're not there yet, but they will be. They're getting very close to where they'll be able to, these professional athletes are using them all the time, wearing them, guiding their training based on, like if you don't have a very good heart rate in the morning, from a variability standpoint, they know from evidence-based papers that the likelihood of you injuring yourself on that day is higher. It's significantly higher statistically. And I think that's where we'd like to be with the horses, is like, if you went out there on that day, even though it was like, I'm supposed to blow my horse out today because I'm competing on Friday, and you get there and there's a signal from your journal or from how you feel or the way the horse is acting, it's like, it's probably a good idea to listen to that, I guess, right? Does that make sense? Like I come from the generation of like, let's just push through that shit. I'm tough. I only slept 4 hours last night and I cut 2 colics and I'm going to work 12 hours a day. We grew up in that generation, and some of the newer stuff that's happening shows that, yeah, you can do that, but you shouldn't do it very often, because you will end up with diabetes or cancer, something in the human. And I believe in the horses, that's where we see all these injuries that end up coming, and these hot horses and different things, and even the ulcers. It's a simple thing to say it's stress, but it's like, if we're reading that, like, maybe we can at least mitigate that or minimize that or prevent some of these things, right? But it would be based on following them and having maybe some more objective systems. I'm going to talk a lot about the HRV over the next few years. I'm hoping these wearables really become something where it's like, for $100 you can put something on your horse. That would be beautiful if we could have something to match with how you feel and how you're journaling, right? And do you do that with your horse? I feel like you do. We haven't really talked about it before, but I feel like you have a very good feel of like where you're at with your horse, right?
Yeah, totally.
Yeah.
So again, the questions are just flowing perfectly, because the next one down was, can ulcers then create body pain that's not truly a physical problem, or vice versa?
Yeah. So I would say one of the most striking things that happens for me in my daily practice, and I took it out because I was trying to not have too many slides in, but I took out my physical exam and the dynamic exam. I talked about them a little bit, but one of the things from our physical exam is horses that have some pretty agitated or aggressive ulcers. I will find that when I'm doing my trigger point exam, that they'll light up and I'll be, is it their front feet? Is it their stifle? Is it their hock? Even before I've touched the legs, because the nervous system is so jammed up, I guess, is that the way to say it? Like, I'm trying to think of a way to say it. Like their nervous system, it's hyper reactive, and because they're a flight animal, you'll see those horses moving away from you. You'll get the odd mare that want to bite you or kick you. Geldings will kind of go into a zone where they're just like numb and you can't find them. They're not available for you to speak to them or see what's going on because they've gone to another zone because their belly's bothering them. And then they'll look like there's a total body thing going on, but those horses have quite a bit of belly pain. I brought it up, and I'm going to say it again, and I know it's the fourth or fifth time, but I read a book about 2 years ago that said sometimes people have to hear things like 6 or 7 times before it hits. There are as many nerves in the gut of a horse as there are in the central nervous system, right? And we're very aware since like 2004, 2005, that the central nervous system doesn't just tell the gut what to do, the gut is telling the central nervous system what to do. And so the answer to that question is yeah, it is.
Yes.
And the gut health is so important. I'm going to go in a rabbit hole for about 30 seconds and then you can stop me, okay? And I'm not trying to say inflammatory things or get a conversation going, but I do think we have to look at what we're doing with the food that we're putting in these horses, okay? And this is just a comment, and it's something that I think about often, but it's if you are feeding foods that have been sprayed with chemicals or has been genetically altered, and you have a horse that's taken 2,000 or 3,000 years to evolve, more, 50,000, I don't know how long, anyway, thousands of years. It's just that sometimes I think the feed that were available to us to feed to our animals today is not what they were evolved to eat. And I think those are things that are at play too. It's like, so if you have all that happening, and then you have the environment where now they're not out on pasture and they're not running through a coulee and they're not able to run that inflammation out of their body, because they're in a smaller paddock. And again, we're not going to be able to change all these things. I'm not trying to be ignorant to the world and how it works. It's just thinking about that and how it compounds, right? Because if you've damaged 50 mitochondria a day because of the way that the feed that's available and the paddocks that's available and then the training, then what can you do to impact those things to try and move that away? Because once that gut pain has started, those horses are standing in a different posture. They don't eat when they should, they don't drink when they should, or they drink too much, and they bleed, they can sometimes pee out more electrolytes than they should because they're trying to dose their stomach with water. We've all seen that, right? I think those are things that all play in.
Yeah, very good. Next question is, can the nerve regenerate after a long-term sensitivity or pain?
Yeah, this is okay. So Tina and I were talking ahead of time when I did my talk with her during COVID. I talked quite a bit about trying to treat nerve pain, and there was a therapist on the Zoom that was from the eastern part of the United States, and they had an old racehorse that had kissing spine, and it had quite a nerve pain associated with the back pain, and they were struggling with it, and it also had full-on stage 4 ulcers as well. And so inside of that, they had been treating the ulcers would make the horse better, but they couldn't get past that nerve pain because it was just chronic in the back. And the stomach is, if you're thinking about it too, I'll just use this real quick. If I have back, here's my back, and then here's my belly down here, and here's my central nervous system, okay? Well, the nerves that are down here are coming up here too. And so those two things can, you can have referred pain, almost like where if a nerve in an area is turned on, it's like when someone talks about they're actually having a heart attack, but they feel like there's a pain in their pec muscle, and the heart's not at the pec muscle, but it's underneath. It's because that nerve that's feeding that area is feeling the pain. So what we end up doing is we put that horse on some gabapentin to help that nerve pain, and they were able to actually get those ulcers to go away, right? Because the nerve pain from the back that was here was transferring into the viscera. And so once they got it on the gastrogut and they got it on the sucralfate, they were able to physically treat the ulcers in the belly. But once we turned off that chronic nerve pain, then that horse got better. It could not come off the gabapentin because the back had such a physical damage to it. I do believe that some horses can be weaned off of those nerve pains and that you can get that to go away. In the horse, we have no research on this at all. Like, this is all veterinarians playing with fire. And I mean fire in a nice way. I don't mean it like we're Dr. Jekyll and Mr. Hyde doing shit we shouldn't do.
Right.
It's like, yeah, there's some very good stuff in the humans and the dogs. The horses have probably 4 or 5 research papers, whereas the humans, they have hundreds.
Right.
And the dogs, they probably have close to 150, 200 papers on GABA. And we probably only have 10 papers, maybe 15.
Right.
Right. So we have enough to know it's safe and that we're using it appropriately, but we don't know the long term of, like, if I keep a horse on 25 milligrams per kilogram for 25 days, does it turn the nerve off for X number of days?
Right.
We have no idea on that yet. Right. Yeah. And then humans, I think they're getting some of that they're getting that figured out. Right.
Okay, that's great. And a follow-up to that is, would horses with kissing spine be more predisposed to cribbing?
Possibly. I would say any kind of abnormal behavior that we see, like from the standpoint of weaving, cribbing, sucking air, all that sort of stuff, we know that they're trying to soothe their nervous system, right? Like, they're trying to figure out what's going on. So the answer is, there's no evidence-based paper that I could quote, but I would be remiss if I was to say that cribbing couldn't be associated with the back pain. Yeah.
Okay, great. Got a couple more here. Would you say that most athletes are not fit enough?
Yeah. Yeah. I just see so much. Okay. And again, this isn't meant to be inflammatory, but it's just a simple, straightforward statement. If we were to just raise our hands on the Zoom, how many people in here train themselves 5 times a week? I bet it's less than half, right? And that's not a criticism. It's just a simple statement, right? If we're not training ourselves 5 times a week and we're riding a horse, how can we? I mean, there are lots of good riders. I shouldn't be too critical. There are lots of good riders that can figure out fitness, that don't train, but they're pretty fit from the training that they're doing with the animals. I guess, does that make sense? So I think that's the big thing, is like, until we can start to understand where that's at, I think we push horses because their capabilities there. I've seen many really high-end competitive athletes that within 3 weeks of being off for, let's say, 6 months or whatever, it's like, 4 weeks I'll just start hitting some jackpots, or I'll start doing these things, and that horse will do it and they'll be competitive, right? But the reality is they're not fit, and we know, this is a great one that leads into a part that I cut out because I didn't know, I was worried about too long. I was like, at least if the questions get in there, I can drive the questions and people will get what they want, versus me talking about what I want to talk about. But one of the things is tissue turnover, right? Like, I mean, for you, if you go to a horse and it's sticky and you go back 8 weeks later and it's not sticky, well, the tissue you massaged 8 weeks ago isn't there now. It's a different horse. It's a different, not completely changed, but several of those cells have died and went and came back as new cells, or especially the mitochondria, right? Like, they've died and they've come back, and that we've replaced them with new ones. And I think that's the biggest takeaway about training is like, if we're getting a horse fit, which is going to take, let's say, 60 minimum, probably 120 days, it doesn't mean that you couldn't be doing some light competition. I'm not trying to say you should never compete on a horse that hasn't gotten 120 days of riding in, but the simple fact of the matter is that if you're not turning the tissue over at least twice, or maybe 3 or 4 times, how could you expect to compete, and be fit enough? I know at the racetrack when I was there was a couple of trainers that were notorious for overtraining, and that can happen too. I think that's the other side of it. My thing for overtraining is like, you have a very mechanical system set up, and you're just like, well, they should be able to do that. And depending on where you're at, in certain levels, you only have so much time to do your training. And again, this isn't right or wrong, but it's like it's a futurity or it's a derby or it's a 2-year-old filly stake or 3-year-old or whatever. So then, unfortunately, you're time driven, and you get those horses and you have to push on them. I don't love that part of the industry. I'm never going to throw such a big poopah that I'm going to stir up the industry on, but it's hard when you come to that. But I would say the danger is more the nerf bit, I think. And I love my heritage. I grew up in a ranch family, and rodeo's been my sport my whole life. I love all the other ones too, but I mean, one of the biggest things that we see all the time is there's more bleeders in the barrel horses than there's ever been. I feel there's a component of like a lack of response to figuring out the training and how it needs to come together, and the fitness and the recovery. I think these horses can run a hole in the wind, and so we just run, and maybe that's not the answer.
Right.
So
yeah, very good.
Yeah.
Okay, and then the last question, unless another one comes up, Doc. When an area is overused and the cells are not functioning, is it just a matter of time before they go lame?
Yes. Yeah. And the answer is like, depending on how the rider is listening to the horse, you'll see that. I guess the difference is it going to be a catastrophic lameness, or is it going to be a low level lameness? I think those are the things that we see when tissues isn't as healthy as it could be. I think we see those areas blow up, and we all know that they're there, based on, you see the horse. And I have several athletes in my practice that they're only going to be so sound because the arthritis has set in, or the ligaments have been torn before, and when it's healed at a spot where we're just not going to get that perfect range of motion back. I think those are the horses that people do really well with if they can keep them in low level training and understand that there's an area that's hurt, and then how do I manage that so I don't hurt other areas or catastrophically injure that area. And there's definitely a balance there. Being able to adjust the things that you have control over. So if we think about what do we have control over in a horse, we have control over the food, we have control over the water, we have control over the housing, and we have control over the training programs. And I think being able to have a hard look at, or an evaluation of those, and be like, okay, well, most of the time it's hay and oats, right? Okay, well, hay and oats works, but in the situation, if you need more omegas because you have an inflammatory process going on, are you feeding an oil? This is just an example. It doesn't mean you have to do that. But are you also looking at, would pulp be better for my horse? Would Timothy be better? Alfalfa? I mean, it takes some effort sometimes to push that, and sometimes we're limited because we're in a barn and it's only going to be one kind of hay. I think that's a big part of it. And then, is my horse living in the section of the barn that's best for that horse? I mean, sleep is the number one recovery thing for humans, and so for horses, I feel like it's, do we look at that? Do we look at and I see this less and less, but does the radio play at night? You have some horse that kicks the stalls and disrupts the horse next to it. I think those are all things that we have control over, right? And can you adjust those so that you can work with that, let's say, hock that's got arthritis, or that coffin joint that's got arthritis, that you can't make it go away, but can you minimize the stress in another area? And I feel like the low level training on those areas is probably better than the high level speed, especially an older athlete that knows its job. They probably need less of the training and more of the conditioning. Young horses might need more training, a mixture, but their body can take that. I think these are all things that we have to look at. Right.
And I don't think a lot of people break their conditioning and training up.
No.
No.
Yeah. Flat no. And it's just a simple thing. I mean, this morning, I was talking about training, and I was a heavy CrossFitter for about 10 years, and I love CrossFit. But the problem with CrossFit for me was I couldn't stop the conditioning and the training. I had to beat the clock every single time, or I had to beat my friends. And so I ended up being hurt quite a bit, or painful, or in an area where I was like wore out and not recovered. And then I would get hurt because I couldn't slow it down enough to be like, I'm conditioning today and I'm competing on Friday, or I'm competing next week. Now that I've moved to this new training program that I have, it's like you've got forced areas of time of rest, and these are what you do. And then, and then I listen to my heart rate variability, and I try to do those things so that I'm training and not competing on a daily basis. It's hard, when you have a horse that can pee off or do all the shit. You're just like, let's do that today.
Right.
And no, we shouldn't. Maybe we should only do that once a week or once every 2 weeks, or I don't know the answer, but I think we have to be careful with that,
Right.
because they're not conditioned appropriately, and they're overtrained and under conditioned.
Yeah.
I think that's the common scenario. How about we say that? Make a critical state. This is a common scenario.
Yeah, very good. Very good. All right. Well, that's all the questions that came in. Thank you very much, Dr. Hewlett. I think that was an absolutely fantastic night. Thank you so much for everybody joining us tonight. I'll just remind everybody that this is being recorded and will be up on the website. I will send you out a link to it with a code so that you guys can download it as part of the payment or package that you've already put in. Please do give us a week or 10 days to be able to do that so that our tech team can go ahead and get that set up for you guys. If you have questions for Dr. Hewlett, you can find him at Energy Equine. And thank you again, Doc, for coming in and joining us today.
My pleasure.
Absolutely fantastic.
I love working with you.
Yes,
thank you.
Such a great team member, and so grateful to Dr. Hewlett, not just for friendship, but also for helping us out and helping all of the riders out with their horses as well. So thank you again for joining us, everybody, and we look forward to the next team talk. Hopefully you'll join us then.